Medical services at teaching hospitals across Nigeria have been disrupted by a 5-day strike by resident doctors demanding a salary increase of 200%. The Nigerian Association of Resident Doctors says it acted because the government failed to honor pay and staff welfare agreements. And resident doctors at the Jos University Teaching Hospital are staying away from work in compliance with the strike. Some patients have appealed to both parties to reach an agreement.
You are all aware of the brain drain syndrome that is going on in the country, most especially among the doctors and other health workers. You have doctors who are leaving the country in droves, as well as the fact that there are a lot of bureaucratic bottlenecks in the government when it comes to the recruitment of doctors. So that has largely affected the number of our members who are currently working within the health system. So it's one of the number one reasons why we have issued ultimatum now and the past to government.
I would like to say that the federal government should look into the issue, and dialogue is the best way to solve this issue. They should also give listening ears to the doctors and see a way forward, because all this problem between the doctors and the federal government is the patients that will suffer it at the end of the day.
You know, the resident doctors form bulk in terms of number of the doctors that we have in the teaching hospital. So definitely it's affecting the services in terms of the number of patients that we're able to see. The consultants are not as many as the resident doctors. So the patients that the whole complement of the team sees, let's say if they're seeing 100 or 200 in clinic, you know, definitely the consultant alone will not be able to cope seeing all those numbers.
And now the Minister of Labour and Employment, Ngige, joins us now. Good to have you join us on the news night. First of all, we start with the issue of the strike. You know that the doctors are striking. And oftentimes, like they say, when the elephants fight, you know that definitely is the grass gets to suffer at the end of the day. So can you talk to us what are your plans with regards, you know, the striking? We have striking back and forth in the country, and you're aware that they're asking for a 200% increment. So what's your stance on this?
Yeah, thank you for having me to speak to Nigerians and also to speak to the doctors themselves. The strike embarked by the resident doctors is very unfortunate. I never believed that such a thing would be coming now at the twilight of the Buhari administration, because this administration have done everything possible to stem industrial dispute in the health sector. As of the last time, this government had adjusted their hazard allowance for people in the health sector, resident doctors inclusive, and all doctors, and all nurses, all physiotherapists, everybody in the industry. We moved their hazard allowance, which had been 5,000 naira in the last 12 years. This administration changed it and moved it to 35,000 to 45,000 in a band, and paid them arrears. We paid them arrears now to 1 year, and this was gotten by the NMA and the Johesu, acting for both sides. And I don't know. I read the letter they sent to me. They gave me a letter for the strike that embarked on yesterday, Wednesday. The letter, I got it in my office same yesterday. When I came back from council, I saw the letter. And before then, I had been talking with the health minister, who had assured me that he had discussed with them on Thursday, last week, Thursday, which was about the 11th, and that we are all happy. They agreed on certain steps to take. My discussion was on Tuesday, and so I didn't think there was anything like this coming. It's very, very unfortunate. It's very disruptive. It shows no affection for their patients. It shows very serious degradation of the tenets of the Hippocratic Oath to which doctors ascribe to. They subscribe to it. I subscribe to it. Once you finish your medical school and you want to go into the field, you must subscribe to that oath. And that oath says that the health of my patient is the first cardinal thing that I will look at before any other thing. So, this is not to be. However, notwithstanding everything, I have contacted the Nigerian Medical Association. The association have negotiated an increase for all doctors in Nigeria. NAD, Nigerian Residents of National Association of Resident Doctors, an affiliate of NA.
Okay, Dr. Ngige, just allow me to comment quickly here. I think you've been able to...
Affiliate.
I'm quite sure you can hear me, Dr. Ngige. Thanks again for your time. And, you know, good thing you've been able to paint a picture of how the journey has been so far, what the administration has done for doctors. And that's the same reason many are asking, you're a doctor, the health minister is a doctor, and they still wonder why, if you have these conversations with them, they had given 2 weeks ultimatum. How is it that you were not able, two doctors in the cabinet, the Minister of Health and yourself of Labour, were not able to ensure that this strike were called off before D-Day?
We will not be able to do the impossible. You only do the things that are possible. If you give a notice and say A to Z what I need, and in that A to Z, they are all being tackled, and in that A to Z, A to Y is impossible. What do? You ask me to go and withdraw a bill in the National Assembly, a private member's bill, by one Honorable Johnson, representing a constituency in Lagos, who brought a bill and said that before you become a doctor, that his own proposal for stemming migration is that you stay 5 years here and work for 5 years. Forced labor. It's not possible. And I can't stop the bill from going through the legislative process because the man has gone there, put first reading. Nobody can stop first reading because it's done. No legislator can even stop it. The man has taken it to second reading and it has passed through second reading. The next stage is public hearing. Where will I come? I will even come there, not even as a labor minister, but as a doctor, to tell the man that this bill is not doable. You can't enforce it. It's against the constitution of Nigeria. That talks about forced labor. Nobody is doing forced labor. And we can then propose to him things he can go do for him to stem movement or labor migration of doctors. It's a labor migration. Make no mistake about it. So that's one of the things they want. You tell me that your notice is for me to get state governments to domesticate medical residency training fund in their various states. Labor, health is on concurrent list or even residual list, because if you go to concurrent, you won't see it. So no federal government can say medical residency training fund, you must domesticate it in your House of Assembly. No. It's not doable.
To you, Dr. Ngige, listening to you now, the question will be if you had this kind of conversation with your colleagues. First, they are your junior colleagues, some of them. So did you have this kind of conversation explaining to them in clear terms what is possible and what is not possible and what the government can actually do to ensure that this is averted?
We have done so. They have access to me. They have very easy access to me. You can ask them. I'm the minister that they can ambush anytime and come into my office and have discussions with me. We even do the informal discussions. I don't even sometimes bring my officials around. So they know that. And that's why I said to them that what you're doing is doing an entitlement syndrome. Entitlement mentality, which is not good. Medical residency training fund have also been packaged for you. It's in 2023 budget. It's an achievement by their executive. But why then do you say that you will give it to everybody, even those going for exam and those not going for exam, while the package is for those going for exam? So the budget office of the Federation wrote to the college to ask, let us have the list of those who are going for exam, so that when we get it and we do our release, we will pay those people. They said, no, everybody must be paid. And they took word to the Director General of Budget Office and started writing. I told them, this thing is okay. Those who are going for exam, no matter how you get they say no, that they are the ones who will supply the names of their members. No. But this government doesn't run that way. It's finances, it's money. So these are some of the issues. And they also have a problem with the Nigerian Medical Association. They are the father organization of doctors. They say Nigerian Medical Association is not taking them along to go into the negotiation they're having in Ministry of Health over the pay raise. You know, Nigerian Medical Association has gone far with Federal Ministry of Health, Budget Office of the Federation, Salaries, Incomes and Wages, Head of Civil Service of the Federation in the committee. My ministry does observer status because we are the conciliator in case there's problem. So when they complained, I contacted the Nigerian Medical Association president, who gave his reasons for how he chose his delegation. I don't know why NAD is not in the delegation, but he went to their ADM, Nigerian Medical Association ADM, where NAD is represented, and gave his report. He received standing ovation.
Let's move
NAD was present there in Asaba.
Point. You are aware of the brain drain in the system, and a lot of doctors and nurses are leaving the country. As a matter of fact, we do know that we have these people as experts. As much as you've explained all of this, what can be done? What is the way forward in all of this? You know that there is an Abuja Declaration of 2001 which requires a 15% budgetary allocation to health, even though you're not sitting in as a Minister for Health. But then what's your take in all of this? The brain drain, there's capital flights, some of these doctors are leaving the country. So what's the way forward?
The way forward, that's why I say that the bill in the National Assembly will not cure the disease condition the man is thinking about. He's trying to kill a small fly with a sledgehammer. The way to go about brain drain, there's a committee already there. They are working in Federal Ministry of Health. They have come up with their recommendations. It's been passed to the government. The government will, because we are winding down now, pass it to the next administration. But for me, I'm not a member of that committee. The first thing to do is that look at other climes. Do you see doctors going away from America to other places on a brain drain? Answer no. Do you see doctors leaving Britain, UK, Europe to other places? The answer is no. So you should ask yourself why. The simple answer is because to acquire medical education to be a doctor in those climes, you must pay. Because it's a special profession. It's a special occupation. Medical education in America, $100,000 per annum. In the UK, £80,000, £100,000. In Europe,
we're almost out of time.
90,000 euros.
Yeah, Dr. Ngige, we're almost out of time, and I know it's a good thing to...
because
Dr. Ngige...
No. You have to go to the foundation and allow the universities to charge appropriate fees for teaching, for training people as medical
Let me
doctors.
come in here, Dr. Ngige.
Those doctors you see in Europe and America, they are bonded. They are bonded.
Thank you, Dr. Ngige. Quickly here, before we let you go, the administration is winding down, and that's how you started off this conversation, saying, well, it beats your imagination why the doctors will go on strike when your administration should be finishing strong. Time for us to clarify something before you leave. There was this big headline in 2019, still speaking about brain drain, where you were quoted to have said doctors can leave. Nigeria has more than enough doctors. You still stand by that?
Why would they not leave? I have already told you that the Constitution permits that. No forced labor. No forced labor. You can't put them under chains. But you have to make the conditions equable here for them to stay. Number one condition is that they should pay appropriate fees to be trained as medical doctors. If you pay appropriate fees like they pay in America or in the UK, and you borrow money from the bank, and you're paying back to the bank or to the school that paid for your school fees, for your medical education, you are paying back in a 15 years tenure. How would you then live? That's one. Two, you make their condition of stay much better than what we saw. During my time, our condition was not that bad, but it was at least a moderate thing. I can buy my car, I can do so many things, but no mistake about it again. The doctors are one of the people permitted to do extramural jobs to make money. Private practice. They are permitted to add onto their... No other profession, except maybe some time ago that Attorney General Labambo amended it for university law teachers to practice privately. No other profession is allowed to do so. So what all this big noise? I'm a doctor. I did private practice a little while. I have medical practice where I go in the evening and join people with 4 combines even to do that.
Dr. Ngige, we have to go. Sadly, you did not provide answers to my question. I was asking if we truly have more than enough doctors.
Provide answer to you. Those who want to leave can leave. Those who want to leave can leave. We will do mass production. We produce them. Produce. Those people who are leaving are bringing back some money. They are bringing money to Nigeria. They are bringing special expertise. There's some come back with the equipment and open hospitals. And in 2018 or 2019, the FDI from outside was about 28 billion, bigger than what you got from your oil. Out of that 28 billion, 80% came from medicine, doctors abroad. So how would I condemn it completely? It has its benefits and non-benefits, merits and demerits.
Well,
so you go and
I think it's a fine place. We really do hope we'll have you live in the studio so that we can expatiate more and speak more about this medical strike, and as well as your profession. First, you're a doctor before a politician, so we'd like to thank you for your time, Dr. Chris Ngige, Labour Minister for Nigeria.
Thank you.